Hello, this is Armando Menriquez, and my PowerPoint today is going to be about the effects chemotherapy has on the human body. Hello, what is chemotherapy? Paul Ulrich created the term chemotherapy. Chemotherapy is a radiation treatment often involved with drugs to stop the growth of cancerous cells. The process began in the beginning of the 20th century. Originally, it was used to narrow the chemicals that might affect diseases and transplantable tumors that were found in rodents. In 1955, the Cancer Chemotherapy National Service Center was created. Next, I would like to discuss the chemo port. The chemo port is used in chemotherapy to deliver fluids and parenteral nutrition to cancer patients. Doctors connect to a reservoir that is connected to a surgical pocket, often found on the chest or upper arm. Benefits for the port include less interference with daily activities, but however, there comes disadvantages, and some of the disadvantages include the occasional needle insertion. Another disadvantage includes discomfort and risk of extravasation, and this process is actually very expensive as well. Next, I would like to discuss the different types of cell deaths involved during chemotherapy. The first step is apoptosis. Continue on to the next step. The next step is called mitotic catastrophe. This is also referred as biotic cell death. The cell death that occurs right before the process of cell division, and cell division is also known as mitosis. When the process is finished, the two types of cell deaths are responsible for the majority of ionizing radiation induced cells deaths in the patient. Continue on to the third stage of cell deaths. The third stage is known as necrosis, and in this process, the cell begins to swell. The cell membranes begin to break down, and cells begin to change shape and to take shape with the vacuolization along with swelling in the mitochondria. The plasma membrane also begins to rupture, and which follows a loss of intercellular contents. Fourth process in cell death is senescence. This state refers to the permanent loss of cell capacity. The cells are no longer able.
The cells are no longer able to divide at this point. The cells begin to flatten with increased granularity.
Next, I would like to discuss the effects. Next, I would like to discuss the effects that chemotherapy has on the central nervous system. And this has a wide range of symptoms that occur. A majority of the patients experience cognitive dysfunctions. Some examples are attention deficits, verbal and nonverbal learning ability, visual and auditory deficits, and verbal and nonverbal learning was also affected. Moving forward, I would like to discuss how
Moving forward, I'd like to discuss how chemotherapy affects the men. In this process, it makes men's testosterone levels drop and can cause more issues in the future. Some issues include erectile dysfunction, and this process also tends to have make men have difficult sex life, such as unable to climax, or sometimes experience like dry orgasms. Some men patients have experienced thrombocytopenia, and this often causes blood clots and sometimes makes patients bleed and bruise easily.
Chemotherapy tends to affect
Chemotherapy tends to affect women differently. 89.3% of women tend to experience a higher rate of severe vomiting. Women tend to develop a higher amount of mouth ulcers, and these ulcers are caused by because the body is rapidly growing cancer cells, and the radiation is trying to kill it. Women also are known to experience a larger amount of hair loss compared to men.
the chemotherapy process affects the elderly.
The chemo effects tend to affect the elderly in different ways. 60% of cancer incidents occur in adults who are 65 years and older. The elderly tend to have other health issues, and which make them need to take different medications, and sometimes the medications end up interfering with the chemotherapy process. Elderly patients have a higher loss of organ functions. Changes in the kidney and the liver are particularly problematic during this chemo process, and renal function is affected in patients who are over the age of 70.
Now that we're finished talking about the elderly,
We're gonna start talking about the kids. One in every 570 young adults between the ages of 20 and 34 years old was a childhood cancer survivor. Patients tend to develop small white gray matter along with the development of leukoencephalopathies. Some kids 6 years and older have shown to have documented lower IQ test scores. In a study, 40% of child cancer survivors who went through chemo have scored lower than an 86 on a verbal and performance IQ test. The children have also had significant attention deficits and neurocognitive impairments.
diet and nutrition also.
Diet and nutrition effects are also a big part of the chemotherapy process. Doctors advise that certain foods are rejected during this chemotherapy process because of interference. Patients should avoid spicy foods, specifically hot pepper, curry, or Cajun spices. Doctors have also advised patients to avoid a high fiber diet. This diet includes raw fruit, high doses of veggies, and whole grains. Unpasteurized raw milk and milk products that may contain milk also interfere with the process. And doctors also advise patients to avoid cold cut deli meats because they're a huge danger, and they advise if you do decide to eat the meat, make sure you cook it until it's steaming hot. Continuing discussing the diet, 40% of patients have had a decrease of appetite since the treatment started. 30% of patients have reported eating less, and 30.6% of patients have reported an increase of thirst. 48.9% have reported drinking more fluids. 67.2% of patients have reported to have at least one cell sensitivity, and half reported at least one taste sensitivity after or during the chemo process.
And these are my references.